Yes, ma'am.
Okay, it says in his email that phase one, Vance County phase one, Vance County phase two are not compromised, yet the violation says it's for phase one. Does that mean it's for phase one A and not phase one B?
I asked that question and this is what he sent me back, that it was phase one. He didn't say A or B.
The violation says phase one.
Mm-hmm. And that's what he says on the email.
It says it's not phase one.
He's saying that the whole system is not compromised.
He says the Vance County phase one, Vance County phase two are not compromised by these results.
That's correct. He's saying
Violation says phase one.
He's saying the overall.
But at this point, 1B is not online yet, correct? I'm not
C
sure.
is not online. 1B is, let's see, wait a minute. Yeah, no, 1B is not online.
So I'm not sure that
So we just have phase 1A is what we have.
that's it. And as far as the state's concerned, it's just phase one at this point.
Oh, they don't have a 1A. Okay.
That's right.
So this notice does not pertain to any of our northern part of our system or
It
the
pertains
Kittrell,
to what was built in that first phase.
or the Kittrell part of the system.
That's correct.
All right.
So can I ask a question here?
Yeah.
What is the impact of this? I mean, when citizens see this, if I see this, and now so we have excess of lead, I understand that part. The question is, what is the health issue here? How far over is this percentage? Is it at a point where it endangers people who drink it, or is it a fact that we just found a minuscule part of lead that drops us over the accepted limits?
I think
if
it
I'm
was a
a
minuscule.
citizen and I see this, what does it tell me? I don't. The
Right.
questions I'm asking you is real. I really want to know as a citizen, what's the impact of this on me?
And nobody's told me that either. I know it is basically a minuscule part because on that letter, the letter that we received, it tells you what the allowable is, which is 0.015. And what they tested was a 0.030.
I'm sorry, 0.0 what?
What they tested was 0.030.
And the allowable is 0.015.
Right.
Mhm.
The allowable level is 0.015, and what we tested at was 0.030. So basically double of what,
So basically, this is a low level of lead in the system, which has basically no health issue impact on citizens. We're telling you that it's over the limit, but it's nothing for you to be concerned about. That's the message I'm trying to get
right,
to a citizen. We're over the limit, but it's not an issue that you as a citizen on that water line should be concerned about because it's not at a level where it creates a health problem at this point. Is that what I'm hearing?
yes, sir.
What?
And basically when they sent out a letter, when we got our violation.
Yeah, but I'm not interested in what they're doing.
I know.
I want to know this message to citizens.
So this
That's what I'm
is the
interested in.
message that they're sending to,
Do I have that up here?
it says, run your water to flush out lead. Regularly clean your faucets. Use cold water for cooking and preparing baby formula. Do not boil water to remove lead. Look for alternative sources of or treatment of water. Test your water for lead. Get your child tested. Identify if your plumbing fixtures contain lead. And that goes out. They send that notice out to them.
So let me see if I can put this simplistically, okay?
Okay.
Because if you don't tell citizens what I'm talking about, they assume the worst.
I
It's that
understand.
Camp Lejeune business,
Yes, sir.
okay? So if we say to citizens, we exceed the limit, but the county is now in the process of treating the water so that it is in compliance. But at this point, there's nothing for citizens to be worried about or concerned about health-wise because we have exceeded this limit by so amount of money. Is that right?
That's correct. And they feel like that the lead come from the installation evidently of 2 meters at them locations
Right.
is why the lead.
But my point is, I want to attach to whatever we tell citizens. I want to attach to the fact that we're going to tell them that there's a lead increase and all that. But attached to that is we're going to tell them there's no health concern problem at this time, and the county is treating the water to get it back into compliance. That's the message.
Is that the case though?
That's what I'm asking.
Yeah,
Well,
what it says
that's
here,
not the case. We can't tell them that.
it says that on a 3-month monitoring period of January 1st, the lead action level of 0.015 has been exceeded.
Mhm.
Your system has had a 90th percentile 0.30 reading,
Right.
which is in excess of that. That's why we're getting this action.
That's correct.
Right.
So my assumption would be from that is that we've got excessive amounts of lead in the system. And
There's a health issue attached to that. You think there's a health issue attached to that? Is that your assessment?
if that, it can be, I mean, just like lead paint. Lead paint can be dangerous to kids and when you get certain levels. You know, the thing is with me is that this LO6 and LO7 are 2 addresses that are on the system. One being on Vicksburg Road and the other one being on Warrenton Road. Now, the dot on the Google map shows this 3175 is actually at Allison Cooper, right there on that road.
What about Allison Cooper?
That's where it shows the one on Warrenton Road, the 3175 Warrenton Road, the one identified as LO6 with 3175 Warrenton Road reflects it right at Allison Cooper Road. The one on Vicksburg Road is before you get to Steve Dickerson Road.
Mhm.
So what about Allison Cooper Road? You were saying something.
There-
It was
there are
just,
two-
and that's at the intersection. All right, close to the
Right
intersection.
near the intersection there, yeah. So, and so I'm wondering if, you know, when we built our system, there were all kinds of things in the specs that said you couldn't have anything had to do with lead, soldering, anything. So there should be no lead in any of our system. So we've got to figure out the source of the contamination. And so is that by some design flaw in the system, or is it by an individual installation? And does correcting these 2 individual points of testing correct that?
Yeah, and I'm working on finding all that out.
I was gonna say, if you give us the opportunity to get more information, we'll make sure we get your questions answered.
As a resident of Vance County, but in the city limits, I've gotten notices from the city water system, and they've had issues, and they basically just let the recipients know that there was issues with the water, and they stated that if there were elderly people or if there were small children, you may want to refrain from drinking the water until those issues are cleared up. And then that gave people the decision whether or not they wanted to drink bottled water during that period of time, or they wanted to continue to drink water that came from those sources. So I don't know how EnviroLink intends to notify the individuals, but there are people who have compromised immune systems or whatever, and they don't need even a small amount of lead to potentially infect their systems or anything or compromise their system. So I'm just wondering if we can know what exactly EnviroLink intends to put in notices if they decide to notify people specifically, you know, what notices they will be included to make sure that those citizens who choose to take a safer route decide they want to use bottled water rather than drinking from the tap. So I would appreciate, you know, someone looking into that as
Yeah.
well.
We'll find that out.
Thank
Yeah,
you.
that's an excellent idea. That what she just said is an excellent idea that EnviroLink and EnviroLink would be doing it by address. In other words, if you live along this, they would put a flyer, as the chair lady just said, at your address, they would drop a flyer off and let them know exactly what's going on and what the repercussions are. And they could take the actions that the chair lady just mentioned, bottled water, whatever. But I think also in that flyer, we should tell them we're working on getting it corrected and we anticipate having the problem corrected by whatever date that we anticipate having, that, you know, the county's working on getting rid of this. And then we anticipate having the whole thing cleaned up by 1 January or whatever. What Carol just said is excellent. I mean, that's exactly.
And that was one of the
Environment needs to put
reasons-
that flyer out there at the specific address.
And that was one of the reasons we recommended they put it in the mail out with their bills, not just having it posted somewhere that you might see it
But can you
in
tell,
here.
well, can you tell me in terms of addressing the problem, what did they do to clean it up?
They haven't told me that either, but I have asked. And I will continue to ask.
Okay.
So let me ask you this, when was this detected?
Uh,
The date on the actual lead and copper percentile summary says 7/18/2023, but the compliance period says June 1st through 9/30/2023.
So it was first detected in June? Is that what I'm hearing?
Well, July 18th. Mhm.
Did they
So for
randomly
4 months,
check how,
for
when
4
they, in
months.
terms of detecting this, did they randomly check or there's a system for doing it, for checking it?
from my
That either, right?
understanding by talking to them, they they randomly check them.
Randomly
From
check?
me talking with them through email.
Could you find out for us in terms of what type of schedule they have in terms of checking it, please, so that we have an idea as to how often it is checked?
Yes, sir.
Okay.
I can do that.
My,
Okay.
my concern here is, if you have citizens who want to start trouble, who want to litigate, that's what I'm concerned about, is litigation. Their argument is, you waited 4 months after you found out to tell me this?
And we just,
I've been drinking this water for 4 months and you knew about it 120 days ago, and you just now getting around and tell me this?
we
I've been drinking
received
this
our
water for-
letter November the 2nd.
Say again?
We received our letter November the 2nd.
But we just
So
got
we
the-
didn't know about it until November the 2nd, not
Yes, sir.
July. I heard this July business.
Okay, when EnviroLink monitors and does this monitoring, which should be at least monthly, do they send that off for testing or do they get the results and forward that to?
I'm not,
This is an EnviroLink. This is DEQ, and remember, we buy all of our water from the city. So when it comes through us, the city, we purchase all of our water. EnviroLink is just our meters and they install and our maintenance contract for our water system.
They manage our
They
system.
manage our
That's it.
system.
Correct.
So when DEQ does a random test like this, it's through, not EnviroLink doesn't do this, DEQ does it. And then it goes back to the city and then we follow their protocol because we purchase our water through. them.
DEQ does these testing. This is not EnviroLink. Because I
Right.
know as an operator of a system, an
Mhm.
operator is responsible for monthly testing on the system.
This particular fine is through DEQ when they found. So when EnviroLink does its testing, if they find something, then they will let us know. When they did this, that's why he said before that they're pretty sure it's just such a little bit amount that put it over that threshold because of the meters. And it might have been a new install, it might have done this, and it might have been that perfect timing where they put that meter in the ground and then the very next day they read it and boom, it went over just a little bit. But that's the protocol they have to follow. So this random was the DEQ, not the EnviroLink. And that's why we're having to follow all these measures the way the chair said the city does, like that.
So just to be clear, those people who may not have tested, but in that vicinity, they know as well in case, so that if they want to use bottled water, some people may have that option, especially if they have newborn babies or someone with an immune system deficiency or anything. So they, even though they did not test positive at their specific address, they still have that option if for a while they want to exercise the right to use the bottled water in light of this.
From my understanding, everybody in that area will receive something,
Okay.
some kind of notification.
And I'm sure with this, there's a fairly legal thing that says exactly what you got to disclose, and it'll be sent out.
Mhm.
It's not a boil water notice. It's none of that stuff. There'll might be specifics to that.
Mhm.
But I will find out some other
I think we
information.
should speak with one voice on when this happened, when we first got notice of it. We should all be clear about that. We don't want to be kicking around a July date and some other date. We all want to be clear on, it was November the 2nd.
We got our letter November the 2nd.
Okay, I just want to be clear
Yeah,
on that.
and just to clarify, the actual report from DEQ is dated 7/18. So I wasn't stating that we received it July 18th. It was received on November 2nd, just for clarification.
To help me understand you all, EnviroLink manages it. We buy the water from the city. What has the city done in terms of, this is their water, right? And what they found out is a result of action, the water that the city sells us, right? So what are they doing? Because it looked like it's not necessarily, like we see it as our problem, but it's a city problem. It's the water they're selling. It's almost like you buy something bad from the store and you need to return it because it's.
Don't we wish with the amount we pay? But it's just a precaution. It's just exactly what the chair said. It's just a, hey, we measured this one particular meter or this line. If you have sensitivity, if you have anything in this range, just be careful because we're gonna come retest it to make sure it's okay.
Because when the city sent out, my wife has refused to drink the water since they sent it out. So
Yeah.
I get so tired of hauling those
It's
42
just-
things around. They're
Mhm.
picking up that water. She refused to drink it, even though they sent it and said that it's there.
Yes, sir.
Are we aware of any other notices that any other of the
No,
Call
sir.
Lake Water Systems customers got?
I know,
And
sir.
and it's
we know
even in that email
Mhm.
that it's in the email also that's attached to that there was no other,
They kill us.
No other-
I
Okay,
said
so-
it's slowly killing us, okay.
So we do have a deadline of November the 29th, to get these notices out. That shouldn't be any problem, I take it. And also that would occur before our next meeting in December. So we just want to ensure that, the staff is working on that and we have every confidence that they're going to be able to notify these customers. And if anyone watching, on TV, or I don't know if we're going to mention, if it's going to be mentioned in the paper or not, but even in the notices that we are in compliance to meet the state mandated deadlines. And we do have until December the 9th of 2023 to make sure that notice is given that the documentation did go out. And so we're on it, and I believe that we'll get it done. And I just want the citizens to know, that there's no particular danger at this point in time. We just ask that you use your own discretion in determining how you want to handle the situation. But we as a county want to make sure that notification went out to those people involved. And so from that point on, it's an individual choice in how you want to handle it. And so we thank you for the efforts that you as the staff for our county is doing in making sure that our citizens are protected.
and our deadline for the 29th of November is the reason we brought it to the work session and not to our water board meeting at our meeting.
All right, thank you so much.
Thank you.
Okay, next on our agenda is our jail inmate copay. That is a proposition that has been proposed in terms of our inmates having a copay. And I'll turn that over to our financial director.
Yeah, so I'll
Manager.
start it. I'll
Okay.
start it and she'll jump in with numbers.
Okay.
So staff has been in conversations with the sheriff, other representatives, the health department, et cetera, as it relates to a possible implementation of a jail health copay. A few things to mention before we even jump into this is we will not and we cannot refuse patient care in the jail. This isn't necessarily a cost saving measure, but the inmate copay program would encourage inmates to take more responsibility for their own health care while diminishing the misuse of the correctional health care system. This in turn will allow health professionals more time to direct medical resources to those with true needs. And so we wanted to start having these conversations just because we're spending a lot of money in the jail health plan, and we're actually forecasting $1 million over for this fiscal year. So I'll have Catherine give us some numbers as far as where we are with jail health.
So the state, can you hear me? State statute says that we are allowed to charge up to $20 per incident. They use the term sick call, or up to $10 or $20 for a 30-day prescription of any type of prescription, whether it's any type of opioid or Tylenol or anything they need in there. And it just helps with the funding. It helps make them think more about walking down and just getting free healthcare just to have a reason to go down. We started looking at different avenues of what we actually have control over at the jail. And as y'all all know, it's just finances. So I started calling other jails and our advanced healthcare to see what other counties are doing. And the first thing she said was copay. So I called over 26 or probably more than that counties in the state: Warren, Granville, Franklin, Person, Halifax, Wilson, Pitts, Sampson, even the ones in Virginia, Alamance, Brunswick, Buncombe, Camden, Caswell, Catawba, Chowan, Columbus. We are the only ones that do not do this. Everywhere does this to help mediate the cost. We will not make money on this by any means. It is just to help us conserve our healthcare. Oh, yeah. And here's a handout. And this gives you the statute where we have to have where we provide emergency medical services, and where this would be for non-emergent medical care and prescriptions. I have talked to our local health director. She is on board with this. I've talked to the sheriff and the major, and they are both on board with this. We have, as you can see, our budget versus actual over the last 6 years. I kind of need to take out fiscal year 23 because, you know, the end of 22 and 23 is when we switched from Southern Health, went to the temporary, then back to Medico, and then the advanced correctional, things like that. But as you can see, we have been over budget consistently. And this year so far, as of, I believe, when I put this together was last week, we were already at $395,000 for this year. And we only have a $550,000 budget, which should be plenty because our contract states that we have 84 hours per week in healthcare, which is 12 hours for 7 days a week. This prevents, we have certain situations that people have gotten arrested just to come to jail to have dental work or healthcare. It's just kind of helping mediate that. What I'd like to propose.
Okay, some of the concerns that I have is, whenever, first of all, these are individuals who have not been convicted. They are detained in our county.
Mhm.
Some people may have had a conviction in district or superior court and are waiting for transfer to DOC, to the prison system in lieu of jail. However, most of the people down there are detainees who have not yet been convicted of a crime. Once they enter into the detention center, some of those people who are permanently disabled are going to have their benefits cut off because if they're incarcerated, they are not eligible to receive their Social Security disability benefits.
Yes, ma'am.
Okay, and as part of the Social Security disabilities, a lot of times those individuals are automatically entitled to Medicaid. That's going to be cut off as well. My concern is in those situations where a person who normally gets their medical expenses paid for, had they been able to bond out, they have not been actually convicted, and we do it here in this county innocent until proven guilty, they may be deprived of medical services if they, I know you said they don't have to pay, they won't have to pay. But I'm wondering, would that be a question? I think I had spoke to the county manager about those individuals who had money in their, individual accounts, whether or not that money would be utilized. So I want to, you to
It
answer
will.
that.
So, and it'll be determined by the nurse and doctor on staff, whether it is emergent or non-emergent. If they determine that it's emergent, we will cover it. That is the law, that we will make sure they have care. These are just for the extra. They are, they are in our care and we will take care of them. This is just above and beyond for non-emergent. I don't really know what else to say about that, but they will.
Of course, we can't refuse care. It's
Right.
just situations in which, it's from my understanding, there have been examples of, a resident. I won't call them an inmate because I was told by Sheriff Brame today that they're residents. So a resident may ask to go daily for ibuprofen because they have a headache. Sometimes you could just maybe go lay down and let that headache wear off a little bit, but they have a tendency, there's a pattern of going daily to see the nurse. So in those situations, they would possibly have the money taken from their canteen. But if it's emergency care, they will be provided care. So.
And where that ibuprofen would charge us would be $200, we would still have to pay the balance, but they might think twice if they have to pay 10.
Yeah. On a daily basis,
For
if they're
that,
going
on a
back
daily
and forth.
basis.
Yeah.
Okay, so one of my concerns would be if someone has money in their canteen,
Mhm.
but they're sick, and because they don't want to spend their money in their canteen, they don't get the proper medical care, and it's something that may spread to the other inmates. Has the sheriff looked in those situations, how they're gonna handle that?
Again, that would be at the determination of the medical professional on staff,
Mhm.
whether it is a non-emergent sick call or you are sick, you are allowed to be seen. And I've heard that they are pretty lenient on those, but it's for the repeat offenders and where, they might get a paper cut and walk down there to get a Band-Aid and it charges us $400.
Yeah.
Or
Yeah.
but they'd be okay.
Right.
But they want to get out, they want to walk around and they have.
Yeah. So if the nurse or the health practitioner recommends that this person can kind of weather the storm and you don't necessarily need a Band-Aid, then in those situations, if you want to go, then we're going to charge your canteen. But if you don't want to go, then hey, let's keep your money on your account. So just kind of discouraging them from going on a daily basis, pretty much. Yeah.
So in those instances where someone actually really needs to go, but they're not gonna spend the money in the canteen because they'd rather have the money in their canteen, to spend on, ancillary costs. Are they gonna be forced to go? It's something that could technically spread to other inmates and be able to keep the money. Are you gonna actually pull that money out of that canteen if they go?
No, the medical professional they'll be the ones, it's not, hey, here's $10, can I go?
Right.
It is, they will go. And if it was determined by the medical professional, this was emergent or non-emergent, that thing, and it'll help just mitigate it from there in the future.
Okay, what I'm asking is someone who won't go because they don't want their canteen money used, who really
Needs care.
needs care because it could impact the other inmates. Have they discussed how they're gonna handle that type of situation?
I don't think so.
I don't think so.
I don't think so,
Okay,
but
so
we
I would
can,
just ask
yeah.
somebody to look at that, because a lot of times, even in the community, sometimes you have people who need to go to the hospital, but because they may have this money set aside for something else, a
Right.
bill, grocery, whatever, they won't go.
Okay.
And they may have a condition that could technically affect other people.
Okay.
And so that's one of my concerns, that somebody might not get the care they really need because they don't want to use up their canteen money.
Wait, I can ask. From the financial point of view, from other facilities that have done this, they have noticed that it has cut their costs significantly, at least 25 to 30%, just because of it's not a money maker. It will just prevent us from being $1 million over budget.
My thoughts are that with all the other institutions doing that, that they have reviewed this and made sure that there's a distinction between emergent and non-emergent
Yes,
care.
sir. Mhm.
Um,
And the state, excuse me, Dan, or Commissioner Brummett, I talked to Anita Wilson Merritt, who is the medical for the state department, and she confirmed that, she confirmed the state statute, and she also confirmed that the federal prisons do this as well.
Of our average 135 inmates, what percentage of those are convicted and serving times within the 180 days? Because now those people don't go out anymore.
Oh,
I don't know.
I have
They
no
don't go to a state, if you're convicted of something less than 180 days, you serve your time in the Vance County Jail.
I don't know what that
Yeah.
would have to
Mhm.
do with medical.
I'll have to talk to Sheriff Brand because I don't know. I don't know the answer.
But I did just, if we had 135 people in there, the same 135 people, and we were spending this amount of money, that would be $10,000 per year for one person. For medical.
Okay, so another concern of mine would be, I like to watch TV and I see these incidents of these real life stories where someone goes to see a medical professional, but the medical professional determined it wasn't that serious. And the person goes back to the cell and dies. And so are there gonna be, situations where we're gonna make sure that's properly monitored so that that doesn't happen in our jail, because then that'll make the county liable, because a lot of times you're talking about a nurse and not a doctor necessarily examining that person, and it could be something that's internal, that's not visible, but yet it may be something that's more critical than what that medical, the person doing the examination has determined. And so we don't want incidents where the people come, is determined non-emergent, they go back to the cell because they didn't pay, the amount, or and then they go back and something actually happens to them, or they pass away or expire. We just don't want that type of situation to happen in the jail as well.
Right. And we can have a conversation with the sheriff, but I know he has staffing issues, but I would think that a captain or a supervisor in the jail should be able to oversee that.
Or
If that
12 hours a
person-
day nursing.
Yeah. Oh, yeah, that's right.
We also have the nurse there on staff 12 hours a day, 7 days a week.
Yeah. So,
So it's
Yeah.
just being abused. and
Yeah,
That's what
that's really the problem, is the abuse right now. And the oversight is not necessarily there. So just trying to work with the sheriff to get those positions filled so he's in a better place at some point. So that's an issue too.
Additionally, I know if there's a situation that's potentially emergency, our EMS people come to the jail. And I know just from history that they're very persistent that they receive the proper care. And if they need to be transported from the jail, they're
Yeah.
transported.
Yeah, I don't really see patient care being an issue with this, to be honest.
But if that does happen, what she says, Jonathan, how legal, what's the legal ramification for us if that happens?
The legal ramifications for us is ultimately, it's going to be the medical professional that provides and makes all related medical calls that have legal ramifications. That's set forth in our contract. And so if it is questionable, our staff have, and this has been an issue over the years, our staff knows they are not the ones to make medical decisions, nor are they ones to change or question medical decisions. If they have those questions, they've been told you can have the conversation off-site afterwards, but you never question the doctor. And so that's very clear. That was part of our issues and a lot of this turnover that we went through and losing our last provider and bringing in another provider. And so that has been communicated to the sheriff, and the sheriff has confirmed to us that he is following that and making sure his staff are not doing these things that tend to question that. And that's where we're at. Well, we can continue to ask the sheriff to confirm, but these are his folks and his staff. And that's the extent that we can do this. I do not see this, especially when any policy that implements this and puts it into play will reinforce they are not to make medical decisions.
Another question I have is, say for instance, they do come, to the nursing staff because of an issue, and then the nursing staff determines that they need to go to the hospital, will the county be responsible for the EMS or that individual? Any expenses
County.
incurred as a result of EMS?
We're responsible for transport, doesn't have to necessarily be by EMS.
Okay.
And a lot of those transport concerns depends upon having the ability to transport them securely because they are still in prison.
Okay, so that cost is gonna be given back to the inmate for the transportation?
Ma'am.
No, that's ours,
We cover the transport.
unfortunately.
And then once they get to whatever medical facility, then that's on them as well, you know, because then they're no longer in the facility, is that correct?
No, no, if
that's
they are
so-
if they are still
okay,
in
then I'll-
prison in our jail, that's our cost.
That's our
Okay.
cost as
Yes, ma'am.
well, okay, so,
Okay.
okay,
And staffing
All of it. Okay.
for one of our staff, the sheriff's staff, to be there while they're in that facility.
okay.
So have we decided we're gonna implement COPAC?
Right now, I would just like a consensus to be able to bring it back to the board meeting on December 4th.
That's the reason I'm asking the question. We're in a work session now. We're supposed to be making some sort of
Yes, sir. Just-
consensus here. Is that what we've decided? That's what I'm asking the question.
If she's investigating, everybody's doing it, yes.
I'm okay with,
Okay.
Huh?
I'm okay with proceeding.
I'm okay with it too. I just want to know what the board wasn't.
Okay, I guess my issue would be whether or not, you know, this never went to committee, came straight to our work session. Is there a committee that this can go to so that, you know, some of the questions or concerns can be addressed by committee and then brought back to the board rather than taking it directly to the board?
I mean,
You all feel comfortable just going straight to the board, or
I
do you
feel
think we
comfortable
need
straight to
to
the board.
really have further discussions and
Say again, what'd you say?
investigations?
yeah, I mean, to me, we've had some conversations that we would have had in the Public Safety Committee
Okay.
with the majority of our board present, so to proceed straight to the board.
Well, actually, it's not. It's only you. You have two people on your board that's not present.
I mean, but we've got a majority of the commissioners.
So what have we decided? I'm trying to figure out what's.
We're trying to decide whether or not just to take it straight to the board meeting on this, at our December meeting, or to take it before the public safety in case there's additional concerns and questions that need to be addressed before it comes before the actual board. But you all are saying you've asked the questions that you want to ask. And it doesn't need to go before the committee. I believe that's what you all are saying, so.
I think we've vented it enough between those that are here and that should come before the board.
I think that's a chairperson's decision.
Excuse me.
That's where I am on that. Personally, I don't think it needs to go to committee, but that's the chairman's decision.
Yeah.
You decide whether you want to bring it straight to the board or whether you want to take it to a committee.
Because this is something of first impression, I think we've had some indication of it, but there's been no extensive discussions on it. It's been something that's been looked into, and we were notified of it. I would feel more comfortable about, it actually going to the Public Safety Committee with two people being absent who are on that committee, so that they can, confer with the county manager, the financial director, to make sure that we're in the situation that if something goes wrong, that we're not gonna be potentially liable for anything concerning the individuals. We've had complaints, you know, I'm being honest, being transparent. There have been complaints about people not getting the medical treatment that they needed. We've had private telephone calls from parents. We've had private statements from family, friends and such. So I just want to make sure that when we implement this is going to go in, it's going to run smoothly, effectively, and we're not going to have some of the issues that some of the other facilities may have had. So I want to explore what those issues may have been, so that when we make that decision, we're making a more informed decision.
Yes, ma'am.
So I would feel more comfortable. I would feel more comfortable if it did go to committee. It's not gonna hurt anything if it's just delayed 1 month. So I would feel more comfortable if it went to public safety, and if they want to come back in a month or two and say, you know, what their recommendations, I would feel more comfortable with it. You know, I guess of the commissioners, I guess I'm the only attorney, and for about 20 years, I did represent individuals in criminal defense, so I know some of the different issues that could arise. And I just want to make sure that none of those issues come to light. because we didn't look into it a little bit further. You know, I do understand that, other counties have implemented this, the federal system may have implemented this, and I would just like to, make sure that when we put ours in place, some of the kinks are out of it, and we're not even looking at that. You know, because, we can talk all day about what responsibilities are and what we have agreed, that we are supposed to do, but what we're supposed to do is not always what's done.
Okay.
And so we want to make sure when we implement the system of our own, that we have covered everything. We dotted the i's, crossed the t's, and everything is going to be put smoothly in place. One of the things I would like to see added to that is when an inmate comes in, that they are made aware that that's gonna,
That's on the second.
okay,
Form on the back,
Yeah.
that's the current rules and regulations.
right.
And right behind it would be followed with the new code case.
Right, and so, cause like I said, it's the individual decision, somebody who know that they may have a pre-existing condition and they know they're not gonna wanna pay for it themselves. And it may not be emergent, but it's existing and it's debilitating over a period of time, they may make a decision they wanna bond out. Rather than stay down there and depend on the systems, medical systems, rather than come out and get private medical assistance. So I just wanna make sure, that notice is gonna be given to the individual in residents once they make their appearance at the facility and are incarcerated for any given period of time.
Based on what the chairman has said, based on Catherine and Renee, where you found out to save some time, I would suggest that you talk to some of those folks that you interviewed and find out what's been sort of the pitfalls, what have been the things that they've run into, that they've come up against and everything, based on what the chairman just said, in order to save time, because I see you doing this, it's gonna be January, then be February, and we still will not have implemented and everything. So in order being referred to the safety committee, I would suggest that you do some investigation in finding out the things that she just mentioned and everything that the pitfalls they found, the pitfalls that they ran into. Okay?
All right, thank you very much. Number 5 is other business. Does any other commissioners have any other business that needs to be discussed or they desire to be discussed? Is there anything which would necessitate us going into closed session? If not, are there any motions on the floor for adjournment?
Vote to adjourn.
I just
Okay.
want one comment.
Okay.
So coming up on week 3, and I just want to sing high praises to staff. They've been wonderful with helping me get acclimated. And I would just say that Vance County has some jewels, and especially in administration, they've been wonderful. I have developed my leadership team, and my leadership team consists of my HR director, finance director, my special projects coordinator, and my clerk to the board, and they've been wonderful thus far. So very helping me get acclimated to Vance County. So it's been wonderful.
Okay, again, we welcome you and we're glad to have you. And if
Thank
there's
you.
anything we as a board can assist you with,
Mhm.
feel free to reach out to us and we're gonna be there, for you because we want to
Thank you.
make Vance County a successful county.
Thank you. I appreciate it.
I can take this home, Kelly.
So motion has been made for adjournment by Commissioner Brummett. It was seconded by Commissioner Taylor. All those in favor?